We've done a lot of stuff on junior doctors, all right? We know there's been lots of strike action. We know there's a lot of discontent amongst the ranks of junior doctors. How bad is it?
Well, Piers, I've just got off a night shift and I spent a lot of my time not practicing medicine but doing logistics. There were sick children and we knew they were sick, but there wasn't a place to look after them, and we were ringing around trying to find out where they can go. In the height of winter, things were at breaking point. The worst situation was knowing that there were no intensive care beds for children at one point in London, meaning that your sick child...
No intensive care beds in the whole of the city?
In the whole of the city for children. So not only would you be separated from your potentially dying child into another city, but they're being transferred unstable to that location.
Which hospital are you at?
I work at Queen Elizabeth Hospital in London.
I mean, that's a staggering revelation.
It is staggering, but you know what? Since the 80s, there's been a 50% reduction in the number of hospital beds. So a lot of this is entirely predictable based on government action. And at the heart of it is underfunding, under-resourcing and understaffing of the NHS.
If you're trying to find an intensive care bed for a child, what kind of condition, what kind of situation is that child experiencing? And are you talking about they've come into A&E or they're already on a ward and they've taken a turn for the worse? Can you just give us, without identifying a specific child, just give us an example of the sort of thing you're dealing with? Sure.
I mean, we have children coming in at death's door on a regular basis. They come in, sometimes even just walking off the street, often in ambulances, with severe infections, with severe asthma exacerbations. We stabilise them in our resuscitation department and then we take them somewhere for intensive care as needed. And it's difficult because you say to them, they're very sick, you say to the families you're going to do the best you can for them, but at the same time you're saying, well, we've got nowhere to give you long-term care right now. What do you do
if there's no intensive care bed for a child who is suffering possibly fatal consequences? What do you do?
Well, you do the best that you can. You keep them stable in the resuscitation department, but the reality is the staffing levels are at breaking point anyway. You don't have the ability to manage an intensive care. I mean, I remember on one shift running to resus and I couldn't get through one of the doors because there was a patient in a corridor blocking the door. It is overwhelming how busy it is. We have one sick child in the department and the rest of them don't get looked at as soon as they should do. I mean, I remember one shift, a sick child was there at the start, 12.5 hours later, they still hadn't been seen by one of the paediatric doctors.
What do you say? I mean, obviously, we hear these stories about the NHS and people who are working in it are regularly saying it is at critical breaking point. What is the solution other than the obvious, which is more staff and more money? I mean, is it simply that Jeremy Hunt, you claim, is not listening and not taking this seriously?
Well, I mean, there are some things that are very simple. I mean, there's a case of one lady, Iris Sibley, an 89-year-old, fit for discharge, but took 6 months to find her a nursing home for her to go home to. That's £80,000 lost to the NHS system, and it's in the context of 4.6 billion in cuts to social care over the last 5 years. Now, it doesn't take a genius to work out if you spend less money on social care, then you don't have the social care placements to look after people that need it.
So there's a massive blockage with perhaps older patients who are not getting the care that they need outside of hospital, and if that could be released, you think that would relieve the pressure?
Well, the facts don't lie. I mean, 1.8 million days were lost due to delayed discharge in 2015 to 16.
And as the population gets older, this problem just gets worse and worse. I mean, we are living longer and there are more of us, and yet there's less social care than there was when there was a smaller population. So it's a vicious circle, isn't it?
I mean, we have to be responsive to the needs of our population. We have less doctors per population, less beds per population, less funding per member of the population than the average across the European Union. If we're more like Sweden, more like Germany, maybe we'll be taking this more seriously and we'll have better health outcomes.
All right.
OK.
Dr Zishan Qureshi, thanks so much. Well, in a statement, the NHS told us it is under pressure as more and more patients are cared for in our hospitals. But the statement goes on to say, we know that staff in hospitals are working incredibly hard to deliver the best care they can in the available beds as efficiently as possible.